after that, on the drive home, I remember thinking, when you're 100 years old, what do you regret the most? And for me, it would have been not trying to go to medical school. So
Welcome to the Physician Pharmacist podcast, a show designed to shed some light on a very unusual pathway into medicine. I'm your host, Nathan Gartland, and I'm a licensed pharmacist and fourth-year medical student. I'm also the author of PharmD to MD and the owner of the Physician Pharmacist Company. As this podcast has grown, we have had the tremendous opportunity to broaden our scope and explore other non-traditional pharmacy careers. The PharmD opens so many doors, and by listening in, you will have the opportunity to learn from experts in the field on how to start your own journey. Before we start today's interview, I'd like to announce that we are actively searching for new guests to interview on the podcast. If you think you have a unique story or an interesting life experience related to medicine, pharmacy, or business, please reach out for the potential to be a guest on the show, which is actually, in fact, how our guest today, Dr. Samantha Lee, got her spot on the podcast. Dr. Lee is a licensed pharmacist and current fourth-year medical student at Alabama College of Osteopathic Medicine. Her educational journey began at Boston College, where she obtained her bachelor's degree in mathematics in 2014, and then transitioned into the profession of pharmacy after graduating with her pharmacy doctorate from the University of Texas at Austin in 2019. After working at a startup company as a clinical trials manager for 1 year, Dr. Lee applied to medical school with ambitions to specialize in psychiatry. In addition to her medical training, she stays busy working on content creation for the popular pharmacy company TLDR Pharmacy. Thank you for coming on today.
Well, thanks for having me. It's an interesting blog you'll have. So
let's take things way back. When did you start why did you start your career in mathematics, and then how did you transition into the profession of pharmacy? That's really interesting.
Yeah, that's a good question. I've always loved math. I worked at a Kumon Center, which is kind of like a math and reading program. So you get to tutor kids in everything from addition, subtraction, reading, writing, all the way to calculus. And I just liked how analytical math was. I really liked geometry, that kind of spatial concept. And that kind of led me into pharmacy because it has a lot of calculations. And I also loved educating and tutoring during college. So that's pretty much what made me want to go into pharmacy.
Interesting. Yeah, I've never interviewed someone before who's talked about like the mathematics side of pharmacy, which is like kind of the thing that we sweep under the rug because no one wants to stress on that. But so it sounds like you had a pretty strong background, which I think is really interesting. So that's kind of prefaced you to like just the math side of things, brought you into pharmacy, and then did you kind of fall in love with the clinical stuff afterwards?
I did. Honestly, I didn't realize how much pharmacy had to offer in terms of patient counseling, patient education, until I started working at Walmart as a pharm tech. And then I really, really fell in love with the whole medical field.
That's awesome. And so you graduated with your bachelor's in mathematics, and then did you end up applying to pharmacy school, or were you in some kind of like program that kind of facilitated the process? What was that like?
That's a good question. I was working in the ER as an ER scribe. And when I graduated, I kind of wanted to continue working. But I took the PCAT after I graduated college. Then I found a job as a pharm tech and then went from there.
Interesting. Yeah, back to the good old days when they still had the PCAT. I don't know if the students have to take that anymore.
Gosh, I think a couple years back when some schools decided not to require the PCAT, and I think that's a very interesting approach.
For sure. Yeah, now that I think they do things a lot differently with admissions, so that's not really my expertise anymore. Alrighty, so obviously you made it into pharmacy school. What did you love about pharmacy?
I loved how close-knit everybody was. You hear when you're in pharmacy school, oh, it's a family. That was true for where I went for UT. And I just loved everything about it. I love the pharmacology. I love the medications, dosing. But really, I really love the patient interactions the most. Like, I think during rotations, that was my favorite part of rotations, was getting to go and talk to people during rounds, doing med recs, counseling during retail pharmacy. That's what I love the most.
Awesome. And so then, did you ever consider like pharmacy residencies or fellowships because of like that patient interaction, or?
Yeah, I did. It's a long story, and it kind of goes into why medical school. But yeah, so when I applied, or when I decided to switch to medical school, I had already applied to residencies, and I had 7 or 8 interviews lined up. Um, and I definitely was either considering AmCare or ER pharmacy, or probably psych pharmacy at the VA at the time. And what happened, do you mind if I ramble? It's a rambly story. Yeah,
Oh,
so what
absolutely.
happened was I was on my ER rotation, and my preceptor, we're still pretty close now. She always tells people, she was like, "Oh, Sammy was my first student and my first failure," because I didn't even go to residency for that. But I was on my ER rotation, and it was a level 1 trauma center, and we were in the trauma bay a lot. And during that 6-week period, we just saw a lot of thoracotomies for some reason. Um, Usually unusual, but I think we ended up seeing about 6 or 7, which was a lot. And during one of the thoracotomies, the attending there said, "Oh, medical students, glove up. Let me go and show you how to do cardiac compressions." So as a pharmacy student, I asked my preceptor, I was like, "Hey, I've never done this before," because for pharmacists, we just give vaccinations, and that's really the extent of physical patient interaction. And I went and I stood there, and I had, I was manually compressing the heart, and it just kind of fell into place. It was one of the things that really pushed me um, towards thinking about medical school. And then after that, on the drive home, I remember thinking, when you're 100 years old, what do you regret the most? And for me, it would have been not trying to go to medical school. So after that, that's when I withdrew all the interview just invites, which is scary for sure. And then I took the MCAT, and I studied during rotations, which was not fun, and then went from there. So that was a
Wow. That's incredible. I think that's fascinating. So you were halfway, I mean, you were committed to going to residencies. You did all the forecast
Mhm.
applications and everything like that. So
Yes.
this has to have been in, I guess, like probably obviously before the match. So before you submit everything. So like probably January,
Right.
February time
Yeah.
point.
Yes.
Wow.
Yes, it was in
So
January, right during interview season. And it was pretty scary. I mean, I saw a lot of my friends or colleagues now go through the match, and it's scary. It's kind of like looking off a cliff and then, taking the jump, but you get lonely along the way. So,
yeah, I think that's amazing though that
yeah.
you were able to kind of get this
Thanks.
experience where all this hands-on approach, the thoracotomy. I mean, that's wild. I've never seen one of those before, but you hear about it and you're like, oh
Oh,
my gosh. But so you had this, incredible experience where you're hands-on. You were checking out the anatomy and everything like that, and it's kind of like one of those like moments where you sit down and you're like, holy crap, like this was incredible. Um, and
yeah.
so you had that kind of epiphany where like, I need to do this. I need to do something where I'm a little more like involved in the patient, like like with physically, like you said, not just like with vaccinations and so on. So
Yeah,
that I think that's cool.
for sure. And looking back, I mean, I always was way too curious about diagnoses, how to get to a diagnosis, how to form a differential, and I really wanted to have the skill set to make a more complete picture of the patient when they walked in the door. And I think pharmacy is great in optimizing medications and treatment regimens, but it's a little different when you have to come up with differentials and present a patient, and go from there with the treatment plan.
It's interesting you say that. Yeah, you look back and like look at all these little clues that were left behind. Like I really loved this particular like anatomy session, or the brief anatomy that we do get in pharmacy. So that's awesome that you're able to identify that. So you obviously realized this. You had this epiphany, like I mentioned, and then you dropped out of all of you. You basically sent all the emails out and said like, "I'm done. I'm sorry. I'm going to medical school." And then you just picked up an MCAT textbook. Like that's just such a crazy transition.
Yes, yes, that's exactly what I did. I just knew once I had that thought of, maybe I want to go to medical school. I just knew at that point would have been misleading to take an interview spot away from somebody who wanted it more than I did. And I had to order the MCAT textbooks and relearning orgo and physics and all that stuff during the rotations. It was not fun. It was totally like learning something new again.
Especially on like the cusp of graduation too, just to think about that. You're
Yeah,
going back to law
I
school.
don't I don't know what I was doing back then. I just toughed it out. But yeah, I definitely remember my MCAT was May 22nd and we graduated May 24th.
Wow. So you took the MCAT 2 days before graduation. That's I guess that's a good way to celebrate, right? You're done with the MCAT and done with pharmacy school.
Yeah, for sure. I definitely tried to pull some of my friends along for the medical school ride, but they're thriving in their own field. So
What did your peers think about that, like kind of transition? And what did you like your family and anyone else like that's important in your life think about this like kind of dramatic career shift? I know that's something that I think has a lot of friction for some individuals that I've talked with on the podcast before.
yeah, for sure. Personally, for me, all my friends were really supportive. And again, we're still close friends now, all my pharmacy friends. My family was very supportive too. I did have my grandma, who's, a little bit older. She was concerned because as a pharmacist, I didn't work during medical school, but you lose out on all those years of salary. So she really did ask me whether or not I thought it was a good decision. And in the end, I said yes. I mean, I think there's just something compelling about medicine that kind of draws you in.
Yeah, that's a really good point. Like just from the financial perspective, that's something I talk about a lot. Is like the pharmacy opportunity cost that comes with going down this decision. It's not like you're getting a bachelor's degree and then considering
Mhm.
this route where your earning potential is much lower versus a pharmacist. So you have to factor that in on top of the tuition you're gonna kind of accumulate even further.
Yeah, I agree. I agree. And it definitely, I think at the end of the day, for people who want to switch careers, it's a very personal decision. And you kind of just know that, or that's how I felt, that you just know that you need to make the switch and ultimately would be happier as a physician.
Exactly. It's a long road to commit yourself to. So like if you have
Yeah.
any doubts about it, like don't force it. Pharmacy is a great profession. You'll have a wonderful career. All right.
Oh,
But
yeah, for sure. Yeah.
so with that in mind, so you obviously graduated pharmacy school and your goal was to then apply that current application cycle, I, I believe. And so for our listeners who might not be as familiar with that, usually individuals to apply to medical school, it takes an entire year-long process, essentially. So you have to apply, you kind of have a lot of like things planned out ahead of time to make sure that you matriculate in the following application year. And so you got your MCAT score, and then what did you do during the interim in between while you were simultaneously applying?
Sure. I managed to get a job at Subjectwell, which is a startup company in Austin. It was really fascinating. I worked as a clinical trials manager, and basically, we looked at a lot of trial protocols and kind of translated that into patient questionnaires. So during my time there, I also kind of worked with the software development side, which is kind of neat. And we were able to make this huge database of medical knowledge, kind of like an encyclopedia within the system. And so, similar to Wikipedia, when you have a patient questionnaire and the call interpreter is reading it off on the phone, and they come across a word like COPD that they don't recognize, you can click on it, and then it'll show you a little bit about the path of his basic medications and just how to explain it to the patient.
Wow, that's really cool. How did you come across this job in the first place? Like, I feel like a lot of individuals would just like pick up the easy ships at the community pharmacy. Like, this is such a unique role for a pharmacist to even be involved in. So, I mean, if anyone wanted to get
Yeah,
involved in it, how would you encourage them to do so?
sure. So I think I got really lucky with applying. I knew when I graduated pharmacy, I wasn't really meant to work as a retail pharmacist. I had worked at Walmart during P1 year, and then I did rotations at HEB, Walgreens, etc. And it really just wasn't the right fit. So during my time as a pharmacy student, because I was interested in residency, I was also really heavily interested in the research side. So I had a lot of um, experience with research, and that really helped translate over to the job.
Not to mention, it probably helped a lot with medical school applications too.
Yeah, I have a soft spot for research. I just think, especially translational research, when you see like the problem with the community, then you bring it back and you kind of analyze it and you're able to use your results to kind of push the medical field a little bit further. I always enjoyed that, but um, yeah, I love research.
Fantastic. Well, so obviously you had this particular role that you were working in, and so how was it? I guess like what was it like applying to medical school while working like a full-time job?
It was definitely, I mean, honestly, it was similar to applying to pharmacy residencies. To be honest, I just worked and then worked on the application in the meantime. There weren't really any hiccups along the way, especially since I had made the switch during pharmacy school. So asking my letter writers to rewrite a letter of recommendation, it was just pretty seamless.
Awesome. And also, you mentioned that you started kind of working for this other pharmacy company called TLDR Pharmacy. And that opportunity kind of presented itself when you were in medical school, or excuse me, when you were in pharmacy school. So then I guess like how did that role come about and what has it turned into since that time period?
Sure. So, as a P4 pharmacy student, P3, P4, my friend and I just reached out to TLDR Pharmacy to write some guest blogs. So, we wrote one on alcohol use disorder, new drug approvals, and I believe hereditary angioedema, which was pretty fascinating. And then after graduation, Brandon asked me to become a part of the team. And since we're so busy in medical school now, mostly my job is behind the scenes. So I do a lot of the turning the articles that you see online into PDFs. So there's that. And then hopefully I have a couple more articles in the works now that boards season has died down. I'm pretty excited to kind of push those out.
That's awesome. So you're still pretty
Mhm.
active. Is this like a full-time position or it's like a part-time, like you just kind of roll, kind of do things as things progress?
Sure. So Brandon has been really, really nice about my medical school schedule because it's just so hectic. You know how it is with studying for boards and then doing didactics and lectures.
Hmm.
So it's definitely a part-time job for sure. I reach out whenever I have free time, and then if they have something that they want done, then we talk about it.
That's awesome. So that's cool that you've been able to kind of continue this like connection to the pharmacy world throughout obviously medical school and to the point where you're about to graduate. And I'm assuming you're going to continue with that, you know, into the future.
Yes, yes, absolutely. I think that just the integration of it's just a different perspective when you're both a pharmacist and a soon to be physician. That's just such an interesting and unique view to look at the medical world, to apply it to patients and also really to medical education. There's a lot of stuff in pharmacy school that we learned about, vancomycin dosing or pharmacokinetics and pharmacotherapy. And those were just, we had like 8 semesters long of pharmacotherapy. Whereas as you're sure in medical school, it's just a little couple slides at the end and that's it. So
Exactly.
a lot of yeah, a lot of good teaching and learning opportunities for sure.
That's cool. I mean, that's kind of a perfect transition because I wanted to ask you next about like how
Yeah.
was your medical experience? Like, what was it like transitioning from pharmacy school from this like clinical role where you were, you know, working and then going back to school? What was that like for you?
Oh my gosh. It definitely was really tough transitioning. Um, just because again, the loss of salary, that was a big hit because I was managed to save up some money when I worked. So I saw that go away into rent. Being a student again and just the breadth of information that medical school expects you to know in that first year, it really, I don't think anything could have prepared me for it compared to pharmacy school where, I was able to have a social life and have friends and have some fun. Where medical school, I really had to stick to the grind. Um, so it definitely was a tougher transition, but it's kind of even things out as you progress. Yeah.
Yeah, in my experience, it's kind of like the equivalent of getting hit in the head with a brick, but like you get up and keep going.
Yes. And gosh, there are just, I think medical school, it definitely pushed me at least to my limit in terms of what like I could do and then push pushed me beyond that, basically. And then you kind of recover a little bit, you become a stronger individual, and then you just get pushed to more information. It definitely felt like the brick experience for sure.
And that's the thing too that you kind of mentioned is that, I'm entering medical school and I'm under the impression that there's going to be so much pharmacy involved in everything. And in my experience, there really wasn't as much pharmacy, or I always heard the reputation like, oh, medical students don't get as much pharmacy exposure, blah blah blah. And I was like, there's no way, that's not true. And then I get there, I'm like, wow, where is this pharmacy? Where are the drug questions on the exams? And I'm waiting for them. Obviously, very biased. I would prefer to have those, but obviously, there's a lot of things I have to ask about, and so I was kind of like shocked that there was so little of that. Maybe you have like the same experience, different.
I definitely did. I was surprised. I remember when I was a pharmacy student, I had this brief conversation with a medical student, and she said, I don't understand how you guys know everything about the mechanism of action, contraindications, dosing. And then I said, oh, it can't be that bad, right? And then I went to medical school and I was like, there is so much more that is just so different that there's really not time for pharmacy. And again, as an extension, you can kind of see where pharmacy has to be its own field. There's just so much you have to know, especially keeping up with clinical trials. I think that as pharmacists we can, but as medical students, it's hard. There's just so much coming at you that it's hard to have time to sit down and read through literature.
Exactly. And medicine and just like the medications that are coming out have gotten so complicated over these past like just 10, 20 years even. You go back 30 years ago and they had 15 drugs to know and you just had to know those really well. But now there's, 800, 900 that you have to know in and out, how they interact with each other. So it obviously like proves the worth of having like the pharmacy profession, of course.
Yeah, for sure. I feel like, since I graduated in 2019 and it's only been 3, 4 years, but I feel like there's just so many medications that have come out that it's just kind of passing you by and you have to really take an evening to catch up. That's how I feel.
That really resonates with me because some new drug will come out and then they'll be like, "Oh, Nate, you should know about this, right? You're a pharmacist." And I'm like, "I've never even heard of this." Like, it's
Yeah,
hard to keep up.
there was one that I really found. What was it? It was like Austedo
Oh yeah.
XR, and then I think, oh, I forget the name, but it's basically the long-acting or the XR version of buprenorphine, the Sublocade injection, and
Mhm.
that just came out, and I was just like, whoa, there's just so much. There's just so much. Yeah.
Absolutely. And so obviously like we're going through medical school at this point in time and you're thinking about all your pharmacy things that you need to know. What I guess was your hardest year in medical school? Now that you're on the back end of things, what do you think was most challenging?
Pretty much second year. Second year, for some reason, when we started going into all the systems, that was really tough. And then the fact that we had boards coming and none of us really had prepared for boards in the way that they want us to, that was really tough. And then dedicated was just a whole nother nightmare that I'm glad to have put, beyond me or whatever now that boards are done. But that definitely was the toughest year. Really, there were a lot of times where I had to ask myself, is it, do I really want this? Do I want to keep going? Is it worth it? Just dedicated was tough. And, going back, like when we're pharmacy students, you hear my friends, oh yeah, dedicated is really awful. And I'm like, okay, yeah, it must be bad. But when we studied for boards, it wasn't that bad for pharmacy, or at least for me, it wasn't. And then I go to medical school and you have like just really the 6 weeks or 4 to 6 weeks of dedicated that just kicks your butt.
It really does. And for our
Yeah.
listeners, dedicated refers to basically a period of time in which most medical schools will grant you like relief from any kind of classwork or any responsibilities, clinical responsibilities included. And you basically, your only job is to study for your boards. And so that sounds nice, at face value, but then you think about it like Sammy was saying, is that now you're sitting there doing 16 hours a day of textbook reading and you slowly go crazy thinking about oh, I should have gotten this question right, or I missed this tiny little detail. So, and you do that for 6, 7 straight weeks, and then you take these massive boards which are like 9 hours long, and it's a blast. I highly recommend it.
Yeah, for sure, for sure. It was definitely times where there are forced exercise breaks or forced, at least TV breaks or something because like you said in the beginning, it sounds okay, oh, 4 weeks, 6 weeks to study. But then you really start going to the grind and you really start having to do those 8 hour, 9 hour days, and it just gets to you.
And it's interesting too that you mentioned like the resilience to kind of get yourself through this period of time, because I think pharmacists are in a unique position who like go down this particular route, because at any moment you have this thing linger in the back of your head saying like you could quit right now and work at CVS and have a job in a week. And that like eats away at you, I think, a little bit sometimes when the going gets tough. I think that's something that you have to those evil thoughts play around in your head, and you're just like, oh gosh, like I don't have to do this anymore. But I'm glad that you
Yeah.
stuck it out.
Yeah, there's definitely been a couple of times where I called my mom after an exam or after one of those practice board exams. I'm like, Mom, worst case scenario, I'll come back and I'll work as a pharmacist in Texas. It's always there in the back. But at the end of the day, like I said, it's about, like you said, grit, determination, wanting to push through. So,
And you get through. Like everyone gets
mhm.
through. The real test is getting into
Yeah.
medical school, and then once you're in, 99% of people will get through and graduate. So how do you think medical school compares to pharmacy school from like a volume perspective, and then maybe from like a clinical perspective? Like we haven't really talked about clinical rotations quite yet, so maybe you can expand upon that.
Yeah, sure. For volume perspective, medical school hands down has so much more information. And it's really critical thinking information for the questions that I found versus for pharmacy, it's more kind of like being a little dictionary or encyclopedia where if you know it, you know it. But for medical school questions and boards, there's always that, well, there's an answer that sounds good, but this one also sounds good and they all sound great. So it's a little more reasoning. In terms of clinical rotations, gosh, it definitely it's very different. So for pharmacy school, you get 1 year of rotations. For medical school, you get two. For pharmacy, you definitely have required rotations in community pharmacy, which is retail, and then inpatient hospital. I did a couple with psych pharmacy, critical care, NICU, PICU, which I thought was cool, and ER. And a lot of your role as a pharmacy student, again, is really to optimize the medications, to make sure that they're being dosed correctly, etc. There's not a lot of patient interaction unless it's in that retail setting. A lot of the interaction is between you and your preceptor, from my experience, and with the physicians, the nurses, versus medical school definitely is a very independent process for me. Usually the attending will let me go see my own patients, form a differential diagnosis treatment plan, and then go back and present, and then you head in together. A lot of talking. A lot of talking. Yeah.
Absolutely. And then you go back in there and the patient tells you five different like red flag signs, and you're just like, and the attending looks at you like like you've never seen them before, and you're like, they didn't tell me that. love
Yeah,
love when that happens.
It's happened, but you just roll with it. Sometimes it's just different perspective, and sometimes the patient's just more comfortable with the attending that they've seen forever and ever, and that's okay too.
Absolutely. And additionally, so we kind of covered like a little bit about rotations. Now, for our listeners, normally you'll take a couple years of didactic work in medical school. You'll take your step one boards, which we kind of discussed is like that really long dedicated period. And step one is a brutal test. You'll go on your clinical rotations, and you'll do your first year of clinical rotations. You finish that, and then you'll generally take step two, which is the second set of medical boards. So I'm curious to know, Dr. Lee, what do you think about step two? Obviously, you probably just took it recently, as did I. How did that compare to like
Mhm.
step one, in your opinion?
Sure. So step one definitely was more like histology based, microbiology based, versus step two, which was more next best step. What's the best treatment? Definitely a lot more clinical reasoning than before. In my opinion, I felt like there are a lot of questions where all the answers were right, and you just had to figure out which one was the most right. Um, and then as a DO student, I also took Comlex, so I've been taking double boards, which is another toughie. So,
Absolutely, just a lot of like extra mental bandwidth that you have to expend just to just to sit for those boards. I can imagine Comlex.
yeah.
Is it the same duration of time too? I think so, right?
I believe it's a little bit longer. It's either the
Longer.
same duration of time or it's definitely more questions. So I think for step, correct me if I'm wrong, it's what, 280 questions?
Yes, I think so.
I think so.
All right.
And then for Comlink, I can look real quick. Comlink,
I think step two is 30, so it's 8 sections of 40, right? So that should be 320.
Mm-hmm.
So step one, I think,
Okay,
is
yeah.
280. Yeah, yeah.
Gotcha. Yeah, so if step 2 was 320, then Comlex 2 was 352. So
Wow.
we had
So
extra
that's
questions.
that's
Yeah.
just extra fun.
It is.
Great, great. So you're obviously progressing through medical school. At what point did you realize that you were interested in doing psychiatry?
Well, funny story. I was interested in it pretty much from, I guess, second year. I mean, I always thought psychiatry was interesting. This is an aside, but I was interested in anesthesiology because of the farm. I thought it would be so interesting, and it would be just great adjusting meds all day, being in the operating room. And then my very first rotation was my surgery rotation, and my attending was like, "Why don't you consider psychiatry because you talk to patients so much?" And so that's, that's when I really started looking into it. I had a family member who had psychiatric issues, and that was very personal to me. And then I was just always been interested in mental health. I think it's good that nowadays people are more open about discussing depression, anxiety, things like that. And I'm also interested in, the child and adolescent population, especially social media. That's what got me interested. Social media, kids, that population, how they're really easily influenced by most things, but again, impressionable in that you can tell them something and you might think it's the sentence, but then they'll kind of hold it for the rest of their life, and you might improve them that way. But long story short, I've always just enjoyed all of the disorders, the medications, everything.
That's really cool. So it kind of combines like the pharmacy side of things where there's tons of medications that can be employed, but also the hands-on talking, discussing, kind of connecting with patients on a deeper level. So
Yeah,
it's cool that you're able
yeah.
to combine both of those to kind of find your perfect pharmacy profession, or I guess a
Hmm.
medical profession.
Yeah, I definitely, I mean, I don't know how it was for you, but I definitely kind of was not sure about which field to go to. I thought about family medicine for a while, and then I loved my psychiatry rotation. And then, like I said, I thought about anesthesiology for like a brief 2-week period, nothing more. And I don't know, for pharmacy, we have to dose a lot, like vancomycin or adjustment stuff like that. I could adjust psych meds all day long. That I just think it's so interesting, the medications out there and um, all the disorders, etc. So
Well, I'm happy for you. I'm glad you were able to find that particular
yeah,
profession. And so you also mentioned child psych. Now, so from my understanding, psychiatry is a 4-year residency track. Is that correct? And all
yes,
through four, and then are there fellowships afterwards? Is that something like you would specialize in like child psych specifically, or?
yes, yes. So a regular residency for psychiatry is 4 years, and then after that, you can specialize in fellowships. There's addiction medicine, forensic medicine, and then child psych. Child psych is an additional 2 years if you did a traditional psych residency, so 6 years total. But some programs offer a combined residency, which is 5 years.
So definitely the 5 year sounds a little bit better, but I'm sure it's more competitive
Mm-hmm.
based off of that. So awesome.
I think so.
Very good. Well, obviously, you're probably you're in the same position as me right now. Where we're getting ready for AirROS. AirROS for our listeners is the residency application portal. So it all opened recently. So that's probably something that's weighing on you right now. How is the application process going for you? Have you started like looking into it at all, or yeah?
Yeah, I have. I've definitely, to be honest, life after boards has been so much better than life during boards. That applications they're stressful, but they're not as stressful. So you get to work on the meaningful experiences, which I think is a new one this year.
Hmm.
It's tough trying to condense your life into 10 boxes. And then just a personal statement. And researching programs. So it's been pretty relaxed so far.
Yeah, kind of after you've climbed this massive hill that is like finishing step two, which is like the score that defines your residency potential. And you
Yeah,
get over
yeah.
that big hill, and it's like, wow, this is. I mean, like this whole Eros application seems so much worse than from miles away when we were looking at it, but now we're over the hill, and it's not bad. So I'm glad that
Yeah,
you're
for
having a
sure.
similar experience.
I'm glad. I'm glad. And everybody always talks about how fourth year is the promised land. And it really is. I think there really is a life after boards. And that was the biggest hurdle for me was all that stress. And now it's kind of a little different stress, but more downhill from here.
Absolutely. And so my next like two questions are a little bit more like philosophical in a sense, but
Yeah.
reflecting back on like your whole journey, what like if you were to start over again, is there anything that you would have done differently, maybe professionally, personally, anything like that?
Oh, yeah. I get this question a lot. And my answer is always the same. No, I would do it the same way. I think I was able to form so many good, solid friendships in pharmacy, and it gave me such a good background for medical school and medicine that even if it took the same amount of time, I don't think I would be able to shortcut anything. I'd do the same thing. What about you?
Yeah, I always get that question too. That's why I wanted to add it to this component. They're like, well, if you knew you wanted to be a physician down the
Hmm.
road, like, what would you have skipped pharmacy school? And I
Hmm.
always tell them I would never have gotten into medical school without my pharmacy experience. That has made
Hmm.
me who I am. That made me a candidate
Hmm.
for medical school. So no, I wouldn't change anything either. I think those
Yeah,
experiences like kind of build the person to what we are today.
yeah, they really shape and they define you. And I think hindsight's always 2020, but the me that applied to pharmacy school wanted to be a pharmacist, not a doctor.
Hmm.
So things have changed since then, but right at that point in time, it, I wanted to be a pharmacist.
Exactly. I love that. And I guess kind of following up with that, do you have any recommendations for pharmacists or pharmacy students who are interested in going to medical school? Like, what would you recommend to them that they should do or to at least maybe think about while they're kind of getting their education?
Sure. So I would definitely recommend to pharmacy students who know that they want to apply to medical school to be upfront with their preceptors about it. There's no need to be shy. Just say that you're interested in medical school and try to pave your way from there. That way, everything's clear. And it might be a long road in the beginning when you first look at it, but it's not really that long. I feel like medical school flew by. It went
So
by
much
so
faster.
fast.
So much faster
So
than
yeah,
pharmacy.
so much. Yeah, I think it's probably because of the 3 years of didactics that we had to do for farm,
Hmm.
and then just 1 year of rotations versus just the shorter didactics here. For pharmacists that want to become or are looking to apply to medical school, I would say go for it. There's nothing wrong in trying. I feel like once you're at that point where you are looking at other careers, that there's nothing wrong with exploring something different. And I think that the knowledge base that pharmacy gives you is just so beneficial in other careers.
I think that's such great advice,
Mhm.
especially like with what like you mentioned when you're on rotations. Like, be transparent with your preceptors, and
Yeah.
they'll be really accepting, and they can be a great resource for you that they can help kind of launch you into the correct position that you want to go or the route and professional
Hmm.
goals that you have.
Yeah. I've
Um,
never had a pharmacy preceptor that was not supportive. They've all been supportive and fantastic.
I love it. So final question that I ask pretty much everyone who comes on this show. So, what are your personal, professional, or business oriented goals that you'd like to accomplish in the next 5 to 10 years?
I'm not sure about business, so I'll do the personal and professional. Personal, I want to hit 1,000 blog posts or 1,000 inks on that blog. I'm so close, and I know I can do it. So that's a short-term goal. And for professional, I would love to be able to finish residency and mentor students. That's my number one thing. I've always wanted to mentor pharmacy students. I have one mentee who was a pharmacy student and made it to medical school, so she's in her first year.
Oh, that's
I'm
so
very proud
exciting.
of her.
We'll
Yeah,
have to
and I
have her on
just
the
love to.
podcast too.
Yeah, for sure, for sure. I can send her an invite, but just mentoring and education. I think I would really like to be a big part of that.
That's great. Yeah, that's something I personally look forward to too, is like having a medical student
Yeah.
and a pharmacy student, like and
Yes.
then have them work together
Yes.
to do presentations and everything. It'll be fun.
Oh gosh. I told my med school friends, I was like, I can't wait to send med students to do med recs, and they're like, no, please don't. Please don't. But I mean, with my farm friends, I already talked to them a little bit. I said, if you have a pharmacy student and I have a medical student, we can just, match them together, kind of like matchmaking or Love is Blind or whatever, and just make sure they learn a lot. So
Yeah, I think
I'm
that'd be a
excited.
really interesting like experiment too, to have like the medical student go and just work with a pharmacist and pretend to be a pharmacy, student on appy rotation for just like one day or maybe
Mhm.
even like a few days, just to see like what the workflow is and like how pharmacy works. I think that'd be really interesting to check into that.
Yeah, there's just a lot of stuff that pharmacists do behind the scenes. And I think as medical students, so far, we haven't really been exposed to that because we're so involved in interacting with the patient. We're on that patient facing end. Mm.
Absolutely. Well, maybe we'll set something up in the future to some new
Yeah,
curriculum
for sure.
adaptation.
Let's reach out when we're attendings, and I'll send them your way.
Sounds great. Alrighty. So we've come to the end of our interview today, and I'd like to thank all of our listeners for the support. If you have any additional questions about the medical school journey, check out my website at www.physicianpharmacist.com. As a reminder, we're also actively looking for additional podcast guests to interview on the show. If you believe you have a unique story that could be beneficial to the listeners or know someone who would be a quality candidate, please reach out to me personally on LinkedIn or leave me a message on my personal website. Before we let you go, Dr. Lee, how can our listeners get in touch with you or learn more about you?
Sure. So feel free to email me. I think, Nate, you can just attach the email onto the blurb or reach out through LinkedIn. I'm not a very good responder through there, but I'll try my best. But email is the best way to contact me, or the blog. And honestly, I'll try to respond within 48 hours. I'd love to talk to y'all and see who's out there.
All right, fantastic. Well, thank you so much for being on the podcast today. I recognize you're extremely busy, maybe not so busy now that Dedicated's done, but I do appreciate your time and best of luck with your residency endeavors.
Yeah, thank you for having me.
All right, take care.